Hi everyone, so I'm going to do a little video about the theme of this week's readings in our educator class. So the general theme that I kind of found was the general message was limitations to patient progress, be it uh, education, um, patient education, or their time that it takes to heal, the results of their recovery, anything along those lines. Looking at the first article, kind of talked about African Americans, Division One football players, uh, and how they're disadvantaged. So kind of what it came down to is it's a lot of the African American D1 football players go to football as a way out. They're recruited by when they're young. Um, Most African Americans, or I should say, majority of the athletes um, that are African American usually come from poverty or an impoverished area, and so therefore athletics and creativity, comedy are a way out for them. So when they go and do and someone notices that they're good at a sport, they're a little bit faster, they can throw a little bit farther than others. They kind of get taken into this role of okay, maybe I can do well in professional or in sports, and then they end up being you know get and able to get a good education. So they then go to a college or university, Division 1 on a scholarship to play football. So they're employed contractually to play football, and they can't, and then they wouldn't be able to go to school without the scholarship. So they need to play football in order to get the education. But they spend so much time. I believe the article said they spend like 50 or 60 hours on football, and not nearly as many hours dedicating time to their education. So for that reason, it is more difficult for them to get better grades, and the athletic programs want to win. That's their goal. It's a business. They're there to make money. So to do so, they need these athletes to put in all this time, and if they can't put in the time, well then, right, they can't get their education. That's just how it works. So it's just the way the system is set up is not so student athletes can have the best education, but so that just do they can win. And then because of that, they don't really, right? Some of them don't even do their work, and schools have things in place where they just push them along, and then they're not as literate as they should be, which is actually not uncommon to most of the other population, to the rest of the population. One of the studies looked at how educational materials should be set up in healthcare, and most of it should be on a sixth grade reading level because individuals like these um, D1 African American football players, they don't get the college education that a lot of others do. And so, in order for them to understand it, it needs to be dumbed down, maybe not necessarily to a grade of sixth grade reading level, but to a lower reading level. And the other study looked at how the different information is, or at least in a geriatric population, they don't necessarily understand a lot of what is the information that's given to them. So it's limited. Their understanding is limited by their access to healthcare. So if you don't have a lot of healthcare access, you're not around the terms a lot, and it's difficult to understand. Your socioeconomic status, again, that's usually linked pretty linked to education level, and like I said, a lot of these African American athletes, D1 athletes, come from poverty because that's their way out. And the other thing is comorbidities. And now this article, I thought it was interesting because I didn't actually know what comorbidities was or are, and I had to look into that. And so breaking it down, comorbidities are two different diseases or pathologies at one time. So someone who has multiple pathologies makes it more difficult because now they have so much more information that they have to remember, which makes it even more difficult. So how can we break it down for individuals who maybe aren't as literate or healthcare literate? It goes down to we got to keep it as simple as we possibly can and make the handouts and educational material we provide very easy to read, easily formatted, and using very short sentences, normal layman's terms, and then again going back to educating the patient. Another article looked at using telemedicine or using the telephone for nurses to keep in contact with their patients and keep educating them about inputting data. So actually using telemedicine as a health literacy aid, and they found that it improved the patient's care, and it kind of almost gave them a sense of social support, or it might have given them a sense of social support. The evidence doesn't actually say that, but the social support then goes into what the TED Talk in Glasgow was discussing, was really everyone needs a social support system, or you end up on this downward cycle where poverty produces or poverty kind of produces in I'll say incapacity, or this inability to move up in the world. And so I mean, social support then can kind of, if you don't have social support, it's more difficult to get through your cases. And they actually found that, or the doctor in the TED Talk found that it took patients with less social support longer to recover from their injuries. Um, all of which, all of which kind of have an effect. The healthcare literacy and support system all have an effect on how well and how quickly a patient can recover from a disease or injury. That's all I got for today. Thanks for listening, and have a good one.